left side. Turn as far as you can to the right, and then drop the head. I want you to relax. Turn all of this muscle off. There we go. Good. There we go. So how were those?
It's amazing, actually. Yeah.
Not that scary?
No.
Good. Happy to hear. Hi, Kyle.
Hey. How's it going?
It's going well. Thanks for coming in, and thanks for agreeing to be doing a video today.
No worries.
So Kyle is a relatively new friend and a fresh new patient for today, and he's coming in with a variety of complaints. He's a strong guy. He's a bodybuilder in his free time. He does some programming and also works in, how would you describe Global Citizen to people right now?
So we do custom promotional products and apparel,
Okay.
uniforms, any branding of anything. So you want your logo on anything you can name, we can do it pretty much.
All right. Well, a lot of stuff. I'm very familiar with Global Citizen, and they sell so much cool stuff. I'll put the link in the description below. Anyways, so Kyle, what are you coming in for today?
So over the years, first of all, my first time at a chiropractor.
Mm-hmm.
Over the years, never been readjusted, anything. A lot of wear and tear on my body through training and sports growing up. Just need an adjustment. Had some sleeps where I can't fully look left, or the neck's a little tight, so we'll focus on maybe that.
You're saying like you're having difficulty turning your neck to one direction.
Yeah.
And I know you were mentioning like some hip and low back stuff too, right?
Yes.
So what? We'll tell a little bit about that.
So
as
just
well.
just my hip flexibility, squats and stuff. I'm getting deep, but I feel like there's like the range of motion can get deeper
A little better. Okay.
Yeah. And tightness in deadlifts and stuff, that's like usually where I feel it first. Yeah, I'm just interested to see how we can.
All right, well,
adjust
those are
that.
all things that we can absolutely work on
Perfect,
here.
yeah,
Awesome.
fine.
So what we're going to be doing today is we're going to go through a physical exam. Okay, I'm going to check some of your ranges of motion out to see where I can help the most, and then we'll definitely be getting into treatment today. Right off the bat, you seem like the kind of patient who would be getting the most benefits out of some mobility-based exercises, because I know like bodybuilders, and I'm guilty of this too, don't like to do a lot of the mobility stuff when
stretching.
unfortunately it can really help us out.
Yeah.
And then also some sports massage with the tools that I'll show you afterwards, and obviously the adjustments itself that you're talking about. All right.
Perfect.
Any questions for me right off the bat? Or
No.
All right, then we can get into the physical. So I'm going to get you to start by bringing your chin down to your chest for me. Any discomfort or stiffness just with that?
Little stiffness
Little
here.
stiffness where?
Right here.
Right there. Okay. So I'm actually going to take my hand and I'm going to push that further.
Mm-hmm.
Does that make the stiffness worse?
No.
No? Okay. Good. Come back up. And I want you to look up towards the ceiling, okay? As far as you can. So one thing I'm noticing right off the bat with Kyle here is that when he's looking up, he's using his whole T-spine to also look up further rather than just isolating the movement of the neck. So that's another good indicator of a lot of stiffness or some absolutely massive traps. Probably a possibility of both. So any stiffness with this then?
No.
No, you actually feel okay with it. Good.
Yeah,
So I'm going to go ahead and pull this back. How's that?
Good.
That's good?
Yeah.
Okay, good. Come back forward. Good. I need you to rotate your head this way for me as far as you can. We're getting to about maybe 70 degrees at that angle. I'm going to go ahead and pull a little further. So he's got a little bit more range of motion when we force it to about 80. Let's go this way now. And that's less. That's about 45 degrees on this side. So noticeable decrease to the left rotation as compared to the right. We're going to rotate this further, and actually that's kind of locked. That's not going any further than 50 degrees, so that would indicate some sort of restriction or something going on the left side of his neck there. I'm going to get you to tilt this ear down to the shoulder, please. Good, good. How's that?
Not bad.
Not bad. You got some good lateral flexion there, and it goes further with that. Good. And left to left. Good. A little bit. Actually, we just had a pop right there, but a little bit more. Good stuff. Awesome. Okay,
Nice.
good. I'm going to start by having you bring your arms up for me and just keep them there. Okay, I'm going to push down. Fight me, fight me, fight me. Good. And fight me, fight me, fight me. Awesome. Arms forward, curl the wrists back. Fight me, fight me. Good. Fight me, fight me. Awesome. Turn over, curl in. Good. Fight, fight. Yeah, you're strong. Good. Fingers.
Mm-hmm.
So to the people watching, this is an upper limb motor nerve testing screen, just to see if we're having any kind of neuropathies going on, which I'm not expecting there to be one, but again, it's always good form to check for these things. Hands out, fingers spread, squeeze my fingers, squeeze, squeeze, awesome. Lots of strength in all of those movements. So then we're going to do reflexes. So for reflexes, get you to just turn the arm over there. Put my thumb right on that biceps tendon there and hit. And you're not able to see this on camera, but I can feel the tendon fire underneath my thumb when we do that. And here we go. There we go. Big twitch there. Get you to relax the arm. Drop, drop, drop. Best you can. That is a heavy arm, my guy. Jeez. There we go. Got it there. Okay. And we're going to do the same on the other side as well. Cool. There we go. There we go. That's a big one. Yeah. And drop, drop, drop. Drop the arm. Good. That was a little bit bad, but that's okay. You're mostly alive.
Yeah.
Right. Similar to the upper limb, I want you to just push this leg up into me as hard as you can. Push, push, push. Awesome. Push, push, push. Hard as you can. Ooh, very strong. Lift the toes up. Hard as you can. Good. Toes up as hard as you can. Yeah. Nice and strong at all levels. So, again. He's not doing that on purpose. That's what reflexes look like. All right. Big kick. Big kick. Awesome. Good. Now I will get you on your back face up. What we're going to do here is I'm going to come in. And which hip or which side would you say is stiffer than the other?
It's hard to say.
Changes like day to day, not really certain?
Yeah.
Okay, so we'll just do both. We'll start with the right side.
Okay.
I'm just going to bring this leg straight up as high as we'll go. And we start to become limited at about 45 degrees. So I think I know why that's happening. What are you feeling right now?
A little glute.
A little bit of glute. What about hamstring tightness?
Yeah, for sure.
Yeah, okay. So
tight.
we're limited at about 45 degrees of a straight leg raise here due to the hamstrings. Is this kind of the stiffness you feel or not really?
No, it's like a real tight, like squats or deadlifts after the movement.
Afterwards.
In between sets.
Okay.
It's tight, like middle back at the rear.
Got it. Okay. We'll go poking around there afterwards to see if we can find the exact structures. So bringing this up further. This can get a little bit further than 45. You can get up to maybe about 60 degrees on your left side. So it's definitely your right leg that's tighter than the other. But that's just fine. And usually pretty common that we'll have asymmetry on the amount of flexibility we have due to dominance. I'm guessing you're stronger on your right leg. Yeah, it's usually the case. Similar to hand dominance, you'll have traps that are tighter on one side, depending on whichever hand you're stronger, you're more dominant with. Okay, hands coming on your back now. So just going to be feeling through, seeing if we get any tightness in through here. Which this all feels pretty damn muscular, which isn't a surprise, but you okay? Tender up here?
Oh yeah. No, not for.
Oh, but you're hanging in there.
Just felt good.
Good deal. Happy to hear it. So around this time, I usually ask my patients what they find the most rewarding aspect of their job is. Now, you have two jobs. For one, you do program design for like bodybuilding or losing weight, so weight loss, and then you also work at Global Citizen. Which one is more quote-unquote fun for you, or are you not comfortable seeing that on camera?
No. So the bodybuilding, the coaching, personal training, and nutrition has always been a passion of mine. But I tried to make income out of my hobby, so that was the idea behind there. And I just like helping people and genuinely seeing the changes that I can help them make, and seeing them not struggle, but just them fight through like the challenges of the weight loss and dieting and everything, just to reap the reward. Global Citizen is awesome too, because I'm passionate about apparel and stuff like that. I have a clothing company for golf wear brand.
Oh wow! Okay.
And that's how my interest in apparel started, and kind of saw the opening, and have learned a ton. So learning every day at Global, which I love, and it's a good balance of both.
Good. Well, I'm glad you're getting a kick out of both of them then, if that's the case. So I'm kind of jumping the gun a little bit here and doing a little bit of mobilizations in you. This is an osteopathic technique, but it's just because I'm here, might as well.
Feels good.
Happy it does. going to be palpating into the glutes a little bit here too. Okay, so sacrum is the bottom of our spine, right? We have our ilium, the hip bone, right next to it. Glute med, all throughout. We'll start over here actually so the camera can see. All throughout this region, glute med. Okay? And it actually doesn't feel too tender. Like I felt tighter glutes before. Not to say that you're not doing a phenomenal job, but yeah. All right, sacrum, piriformis. Any sensitivity when we're going through here?
No.
No? Good. All right, same deal on the other side. Piriformis. Good. Oh, that's restricted though. That's not too bad, but okay, so once again on camera, you're obviously not able to feel what I feel here, but when we press on Kyle's right sacroiliac joint, like that has no give whatsoever. It feels like it's one solid block almost. Left side isn't great, but it is better than the right side. So right now I'm thinking some kind of restriction along the lower lumbar or the SI joint is kind of where my head's going. We're still going to be doing hip mobility stuff. I'm still going to force them through 90-90s and possibly hip airplanes. He'll probably hate both of them. Have you heard of either of those before? No?
No.
No, perfect. He's going to hate them. But we're going to be doing those anyways too. So I'm just going to feel through. Now, I do believe that your problem was that, yes, it was in left rotation, and I do feel a little bit more stiffness on the left side than the right, but there's also some right stuff going on too. So this will be your first time getting adjusted, and it's going to be your neck. How do you feel? Are you a little nervous? How do you feel?
Yeah, I'm not sure what to think. Let's do it.
I like that kind of attitude there. So we'll start with the right, and then we'll get to the left, okay? But first, I like to do some massage, some form of myofascial release technique, which is just a pin and stretch. So you can't see this on the camera, but I am taking my middle and ring finger and jamming it into Kyle's neck structures here and turning his head as I do. And it's a pin and stretch mechanism underneath the pin that is my fingers. So could be a little uncomfortable, but it is definitely more effective than just your go-to wellness massage. I always go by the motto: if you want to make an omelet, you gotta break some eggs. So he smiled at that. I think he kind of likes that approach. me too, man. I like eggs too. I'm going to get you to turn your head as far as you can to the left for me. Good. And I want you to drop that head. Just relax. You let me hold you. Good. Crunchy. Okay. Thought there was more lower down, but at least we got the big one at the top. Nice. All right. So what I'm going to do next is I'm actually just going to move the mic over to the opposite side. And we're going to do the other side. On the camera, you can see much easier. I'm using my middle finger and ring finger here, pinning and stretching in that kind of manner for the myofascial release technique that I do on basically all of my patients. Good, and relax that. So for left side, turn as far as you can to the right, and then drop that. I want you to relax. Turn all of this muscle off. There we go. Good. Relax. There we go. So how were those?
It's amazing, actually. Yeah.
Not that scary?
No.
Good. Happy to hear it.
Oh my God, so good.
Okay. That feels better to me too. So. Just going to test something real quick so we can get maybe 80 degrees on the right side, which I think is what he could do before. Let's check the left now. We look like we can get to 70, 75. So that's a 20 degree increase, just 20, 25 degree increase just after that. So that's pretty good response in my opinion, and his apparently too. So that's good.
Yeah, no tightness. Like the tightness is definitely not as much.
Love it. All right. And upper back is nothing compared to the neck. So I'll get you to take a big breath in for me, and all the way out. Okay, in, and all the way out. Nothing's going up here. We're getting actually rather good movement. I'm surprised at how well his spine is kind of giving to the input. Which is, I'm happy to see. It means we're actually doing okay up here. What we'll probably end up doing is a lot more soft tissue then with the sports massage, because we weren't quite getting the release I was hoping for. But that's just fine. We'll do that in a minute. You just take a big breath in for me one more try, and all the way out. Yeah, no, okay. I'm not going to fight through that anymore. No, and I think you commented that you really liked the movement down here in the low back, right? What I was doing earlier.
Yeah.
So let's do some more of that then. I'll just turn this. Good. I'll turn that too. Awesome. Kyle is essentially in the right position here. What I am going to do is actually pull this a little bit more, and then you can grip right there. Perfect. So he is rather tight and rather stiff, and some of the big muscular patients that I get are a little bit harder to really get the twisting motion that's necessary in. What we're actually going to do here is I'm going to get you to straighten your knee for me. Good. Just like that. I'm going to bring you up like this, okay? Hold there, and then hold a little bit tighter here, okay? So let's see what we can get. Oh, look at that. Big breath in. And all the way out. All the way out. Yep. There we go. Okay, so we got them all on the first one. Thought there were more, but that's okay. Let's get you on the other side. You're in almost again the right position. Gonna pull. Good. You can hold yourself right there. And you're gonna bring this leg actually just straight up and hips a little closer to the knees. Thank you. And just relax just like that. Good, as best you can. So now keep the leg in like so. Perfect. Big breath in, and all the way out. Ooh, that was a big clunker. Good. All right, so we've adjusted everything we can. We've done the neck, we've done the upper back, we've done the lower back. I think we're going to get into the sports massage component now. So for that, we're actually going to get you shirt off and face down.
Cool.
Okay, I'm in here. You actually have a very large back, so I'm going to need a little bit more of the cream here. Yeah. So you're getting a teeny bit of redness here, okay, but not too much, just so you know.
Yeah, that's cool.
So I believe you're planning to do like a show, right? Yeah. Somewhere. Tell us a little bit about that. You're on the cutting phase now? What's happening?
Yeah, so it's CPA, called the King Kong Classic. It's a CPA show in November. I just went through my bulking phase of 16 weeks. Gained 45 pounds during that bulk.
And what how high were the calories?
They were up to 6,500.
6,500.
Yeah, eight meals a day. It became a second job for me, but we hit the goal that I wanted to. sacrificed a little bit of conditioning through obviously not staying as lean and everything, putting on that weight, but now we're just doing a recomp where we shed a little fat and just try to keep some muscle and strength. And then July 1st marks 20 weeks out, and we will start official prep for it, where we're manipulating calories, adding cardio weekly, or just really how it's prescribed. I work with a coach, Blake Course. Shout out to Blake. And
does Blake have a website or something?
Yeah.
We can put that in the description down below too.
At B Course Fit. He's an amazing fitness coach. He competes himself.
There we go.
Competed at the Olympia this year.
Jeez.
Awesome guy, known from high school. But yeah, so he's helped me along my journey in the past couple of years, and we really got to know how my body reacts to certain foods and what weak points to bring up and everything. And I'm excited to do this show with him by my side for sure.
So you'd say that you're pretty experienced though in things bodybuilding, right?
Yeah. But actually this is my first competition.
Really?
Yeah, so I went to compete at 25.
Mm-hmm.
That was the plan, to compete,
but
and tore my ACL, and now 7 years later it's kind of like my redemption comeback kind of thing. I just want to prove to myself I can do it. It's always been a goal of mine, and
hell yeah, man.
Kind of show my daughters, put your mind to something.
Your daughters?
My daughter.
Okay, I was going to say, I knew you had one. I didn't think you had two.
No, no.
Say, if you have two, I'm so sorry. Man, that's a lot.
No, yeah, so show her you put your mind to something, you can do it kind of thing. So excited for that. It actually falls on my wife's birthday too. So
happy birthday! It's about me today.
That's the funny part. But we'll make it a weekend, and a lot of family and friends are coming to support, so that'll be a lot of fun.
That'll be a blast then.
I bribed them by telling them that they serve alcohol there, so they're good.
Hope they do, because if they don't, they'll be disappointed. Well, I was going to say that there's kind of a bit of a lesson in there, because I know that you are obviously quite experienced in bodybuilding, and you do strength and conditioning as a way to monetize your hobby, right?
Absolutely.
But like, despite your very extensive knowledge in the field, you still have a coach, and that coach is able to push you to limits that you didn't really know before, show you perspective of different things too. Would you agree with that?
100%.
Yeah,
that's what I love about the sport. There's so much. No matter what you learn, there's always more, you know. Like,
and I feel like
tips and tricks
that would be applicable to almost any kind of discipline or craft or hobby or sport. So take it from Kyle here. No matter how good you get at something, always seek mentors. Okay, they're going to help you out.
100%.
That feels like a steel cable right
there. Couple knots.
Have you had this kind of thing done to you before?
No. All I've had ever from my back is deep tissue. Yeah.
That's very different. Different techniques available from different practitioners, right? Yeah. Deep tissue massage. I wouldn't be able to stand there and do that all day. I can stand there and do this all day.
Yeah,
just fine.
That feels great.
Good. Happy to hear it. This. Feels okay?
Oh yeah. That side right
there.
Yeah. Oh, there too. Ooh.
I'm going to stick an elbow in that in a minute, and you're going to have to work hard not to punch me.
Cry, yeah.
That's the deal.
You got me in a vulnerable position. I don't know if I can throw a punch or...
ticklish?
Yeah.
I think my favorite thing about this job is making grown men giggle. I think that's it.
Like a good pain.
Oh no, I know. Right there. That's a squat. Alright, so what we're going to do is I'm going to take my very pointy elbow. Okay. I'm going to stick it right here. But I want you to start with your head up and to the right. Okay. I'm going to stick it here, and I want you to slowly move your head down and to the left. Okay, go ahead. You can go a smidgen faster than that. There you go. Good. And then come back up and to the right. Just come right back there.
Okay.
Yeah. So this is again another pin and stretch. So pin and go ahead, stretch down into the left. Awesome. And again, different contact. Go ahead. So for those watching, I'm putting quite a bit of my body weight down in through his upper back neck structures here. So this is probably a little bit uncomfortable.
Yeah, a little bit.
Yeah. That's the usual response. I'm completely unconcerned here.
Yeah, with the eyes closed, I'm like.
Okay. Face forward and tilt your head to the right, please. Good. And now tilt left. Good. Tilt right. And tilt left. And right. And left. And right. And left. Good. Awesome. Okay. Now we're going to do the same thing, but just to the other side. I'm going to rotate this a little bit. So up and to the left. Up and to the left. Okay. And now down and to the right. Good. And up and to left. Down and to right. Up and to left. Down and to right. Up and to left. And down and to right. Good. Tilt left. Tilt right. Left. Right. It's difficult, eh? Yeah.
It's tight.
Left and right. You're doing great, man. I know this is hard. One more left and right. Awesome. Good stuff.
Nice.
Awesome stuff. Okay. All right. All right. So how was that? How'd you find
It
it?
was a good experience. I wasn't sure what to expect.
Mm-hmm.
Definitely feel much like, I don't know, I just noticed my like looking left, not as much tightness.
Yeah,
significant. Like,
Perfect. Yeah.
Love the cracks. What else? Yeah, no, definitely a good experience. Glad I came, and
Happy to hear
the
that.
way you explained everything was just awesome. Like, I knew what to expect. You know, it made me more comfortable.
I'm actually really happy you said that, because it seems to be a recurring theme. Like, a lot of the patients that I see here, as well as the patients that I actually do treat and post on the YouTube channel, are mentioning that they really are appreciative of taking the time to have somebody explain the things that we're doing, because that makes them feel more relaxed with something that is arguably, like, could be a little bit scary, right?
Yeah.
Like the thought of cracking a neck or cracking your back isn't really something you just like wake up and be like, this seems like a good idea today. But, you know, sometimes it really is therapeutic, and once you get past that initial stage of nerves, it can be very beneficial to incorporate that into your method of self-care or treatment or whatever it is. So glad you found good use out of it. It was a pretty dramatic difference between the before and after almost immediately in your ability to turn left there. So I'm happy we saw that. And unfortunately, we ran out of time today, filming-wise, to actually show Kyle doing the rehab exercises. I'll leave descriptions of them down below, but they'd be hip 90-90s as well as hip airplanes to try to open up a little bit more to make him a little bit more free on those squats and deadlifts that he was talking about beforehand. And I will be sure to show him off camera during his next appointment. But otherwise, do you have any closing thoughts before we kind of shut down for the day?
Just, if you're looking for an adjustment or anything, back, neck, hips, any tightness, this is your guy to call, Dr. Adam.
I like Kyle.
He's been great, and I'll definitely be back. So
thank you, buddy.
Thanks,
Appreciate
buddy.
that.
Yeah.
Have yourself a
Thanks
great
so
day.
much,
Okay.
man.